My name is Patricia Ding. I'm one of the cardiologists at Ascot Cardiology. I'm here with Dr. Warwick Jaffe, interventional cardiologist from Ascot Cardiology. Morning, Warwick.
Morning, Patricia.
So, tell us about the current state of play for lipid management.
In most patients, a statin is given, and if the patient doesn't achieve their target, you'll add ezetimibe.
Right. So what is the target of low-density lipoprotein that we should aim for at the moment?
I describe it as a moving one. A few years ago it was 2, then it got reduced to 1.7. The latest European guidelines suggest that in high-risk patients we should be aiming for an LDL of around 1.4, Patricia.
Right. And so what about the people who can't take statins or don't achieve the target?
That's a big problem, and there's a lot of these people around, and most of them at present go untreated. Overseas, the PCSK9 inhibitors have been used a lot.
And how does PCSK9 inhibitor work, and how is it given?
PCSK9 is a substance that destroys the LDL receptor. So the more LDL receptors you've got, the lower your cholesterol is. So to destroy these receptors, we can produce an antibody. It's like a monoclonal antibody that has to be injected quite frequently, and it's very expensive. So PCSK9 inhibitors have not really been used very much at all. In New Zealand we have Praluent, which is about $9,000 a year, so of course that's not used in very many patients.
What about the other new options?
A newer option is the short interfering messenger RNA drugs. These are oligonucleotides. They're much cheaper to produce, and how they work is quite a different way. They interfere with messenger RNA, which is the messenger that produces the PCSK9 in the cell. So what that means is the PCSK9 isn't produced at all.
So where is this medication at, since it's cheaper than PCSK9 inhibitor?
Well, inclisiran is the first of these drugs. It is in phase 3 trials, which we expect to be completed by the early part of next year, and as soon as the middle of next year, this drug could be available. Of course, the key thing about it is what's the price going to be. The medicines company which produces this drug has just been bought by a large pharmaceutical company for $9.7 billion. So that's the 1,001 question, is how much this is going to cost and whether it's going to be available to your patients.
Right. So just to recap, the target LDL at the moment is 1.4 or less, and new medications available coming to us potentially could be PCSK9 inhibitor plus short interfering messenger RNA potentially be available in the near future as well. Right. Thank you very much, Warwick, for your time today.
It's been a pleasure.
Right.
Thanks, Patricia.
So if you're interested, there will be a link down below for you to read some more information about these medications and guidelines. Thank you very much.